When we start to learn the truth about how important medication is and a continuum of care and aftercare, we can be better partners as family members. My son left detox and he left without a prescription for continued medication. He left without an aftercare plan. He went right back to the apartment where he was staying before he went into rehab his final time. And his brain was completely unprotected because he wasn't using a medication, even though he had been abstinent for 30 days or so. And those conditions led to a fatal overdose. So as we know, 5 to 7 days in a detox center is enough to just simply get the drug out of the person's system. It's acute treatment at that point. But we know recovery doesn't happen with acute treatment. All that does is remove the drug from the system. And so the really important part is what happens next. And when we leave folks to figure that out on their own, or we give them kind of a superficial referral to treatment at some other treatment center, the likelihood is that they're not going to pursue that.
I felt comfortable there. There was people that I went to, school in the past, kids my age, people that I can relate with about some things that I went through in life. And yeah, I considered it a place that I felt safe from the world, the outside world. It's very important for kids to continue getting treatment. It doesn't just stop at 18. It should be getting it throughout their whole life. And what the detox center at Living Hope Detox is providing that. It's providing something that's not just until 18. It can go on through their whole life. So it's great.
We have been doing business as usual for the past 20 years. And the thing that needs to change the most is we need to look at a continuum of care. We know that medication is the gold standard for treating opioid use disorder. And we know that people will relapse 80% of the time if they leave detox unprotected with medication. We know that. So we need to educate families. Families are doing the best that they can. But that's the other thing that I think that the Villa is doing that is remarkable, is they're going to be wrapping families in care as well. And it is a partnership.
I saw a future of just darkness and just repetitive pain and trauma, trying to live a lifestyle that is detrimental to my mental health and my well-being. Right? I just saw myself deteriorating rapidly. You have to find somewhere that you can call home, that you can feel safe, to actually have that growth. It's really hard to grow and change and progress without somewhere comfortable to rest your head at night, where you feel like that's my spot, I'm home. The Living Hope Detox Center is a serious facility that's really going to be for people who want treatment, and it's going to be what the community really needs right now in this, because the community is having a hard time right now with the opioid epidemic and the crisis, because the war on drugs has hurt a lot of people, and the right way to address these things is treatment, not persecution.
Fentanyl is a game changer. It's changed everything, and it needs to change the way that we provide care around opioid use disorder. The Villa is doing that. The Villa is looking at the data. The Villa is pursuing evidence-based practices and protocols. And I can't say that for every treatment provider out there.
The Villa of Hope has definitely helped me get to where I am today. If it wasn't for them, I don't know where I would be today.